We know that clinical variables like tumor size or nodal status, or just simply looking at ER, doesn't really predict very well who remains at risk for late recurrence after 5 years. Adjuvant online, the recurrence score makes a prediction over the entire 10-year period, but it doesn't really separate out your risk for early and late. And so that created a niche to develop an assay that could help to guide, select patients for extended endocrine therapy. And many academic groups, including our group, have shown that this is possible to do by playing around and weighing the estrogen signaling pathways and the proliferation-related markers. And it does turn out that it looks like that really strongly ER-positive patients with high proliferation index remain at risk for quite a prolonged time after the initial 5-year therapy. So that's more or less the group that actually likely to benefit. So the breast cancer index was a molecular assay that is available through a CLIA certified lab, which was designed precisely to help with that decision-making sort of dilemma. And they have at least 3 independent large studies from retrospective archived tissues of clinical trial material that shows that the assay does identify the patients who are at risk for a late recurrence after 5 years. And they did also a really important study on the MA17 clinical trial, where they have shown that the high risk for late recurrence group is actually the group that benefited from the extended letrozole adjuvant therapy. So the MA17 was the trial which have shown that after 5 years of tamoxifen, 5 more years of letrozole is an effective treatment that improves recurrence-free survival.